Segment is sponsored by Munson Healthcare.
Family history plays a huge role in the diseases and ailments that can plague us. Staff with Munson Medical Center tell me in northern Michigan, the number of people who have type 2 diabetes is a little bit above the national average. But physical activity and eating the right foods can help prevent this. I sat down with one man who's working on beating the odds. Rob Ford is conscious about his eating habits. Every time he opens his fridge, it's something he thinks about. And he makes sure walking is a part of his daily routine.
There have been times in my life before where I lost a bunch of weight and then just gained it right back.
Weight has been a struggle for Rob, but a few years ago it became something he started taking more seriously.
My sister passed away about 6 years ago, and that was a bit of a wake-up call.
A wake-up call that's always haunted Rob. His sister died from diabetic complications. The strong family history of diabetes also impacts Rob's two brothers and his dad. So far, Rob's the only one who hasn't been diagnosed.
Preventing it from happening has been a up and down thing. Lately, I have really tried very hard.
Last March, he became part of a diabetic group through Munson Medical Center called the Lifestyle Change Program.
We met every week for 16 weeks, and then we met once a month for 6 months, I believe it was. And so then since February of this year, I've been on my own. But when we were doing the 16 weeks, each week we talked about something specific, whether it was diet and keeping active. The goal of the program was to lose 7% of your body weight and to have 150 minutes of activity a week.
The Lifestyle Change Program is a one-year program. It's based on the National Diabetes Prevention Program research that showed that lifestyle changes will make a difference in preventing or delaying diabetes.
Elaine Lober works for Munson Medical Center's outpatient diabetes program. She says the program coaches patients with developing healthy skills to avoid diabetes and then maintaining those skills later in life.
Diabetes can be serious if it's not controlled well. Controlled well, people can live normal lifestyles. So this is all about preventing or delaying diabetes, therefore preventing or delaying possible side effects of diabetes or complications. Biggest one would be heart disease, eye problems, circulation problems.
The program focuses on two main components with living healthy: weight loss and eating habits.
So there's choices to be made. We're not taking anything away that people like to eat. We're just asking them to look at it a little differently and make those small changes that are going to make a big difference in the long run.
My strongest advice would be to talk to your doctor. You're not going to do it alone. It's so much easier to do it with a group and with some professional advice.
Munson currently offers this program for free. Medicare will be covering the program in 2018, and Priority Health does cover the cost as well. For more information about enrolling, I've posted a link on our website, upnorthlive.com. In the studio, I'm Melissa Smith.